Ladies and gentlemen, boys and girls, welcome to another session of podcast. I wish and I'm sure you will enjoy listening to the broadcast.
Today we talk about psychopathology. So today more than any time ever in the world, we're very conscious of mental illnesses and issues with any medical issue associated with the mind. Thankfully, the stigma associated with this is also, because of the awareness, it's also very less. But the understanding behind this, while there is an awareness, the understanding behind this is not so great. And we'd really like today to discuss this topic in more detail so that we understand what is psychopathology, what are its branches, what really goes on in the mind, so that there's a better understanding of people who suffer from different behavioral disorders. I might not want to call it an illness. So, sir, if you could just tell us medically, what is psychopathology?
Psychopathology is behavioral disorders in simple format. So, if you go to the field of psychology, the subject of psychology, which is very young, it's about 160, 170 years old. So, Wilhelm Maximilian Wundt is the father of psychology, the period between 1832 to 1920, who came out with the concept, defining the concept of psychology as science of behavior or behavioral science, whatever you call it. Previously, it was studied as a concept of science of soul, then science of consciousness, and then it was all scrapped, and this guy has brought that concept. Later on, Sigmund Freud, who was an Austrian, Maximilian Wundt is a German. Basically, the birth of psychology is from Germany, because he's the guy who first set up practical lab for behavioral science, which is mostly covered under physiological psychology. So Sigmund Freud, who came up after him, who was born later in 1856, he lived till 1939, contributed many things to the clinical psychology side. That's where the psychopathology comes. Basically, if you take psychology, it is divided into four major categories in the initial period. Even now it is. It's the one is developmental psychology, which covers from your prenatal development to your old age, childhood, adolescence, adulthood, middle age, old age, all those senile psychosis and all that stuff. And then you go to abnormal psychology, which covers the psychopathology. Then you have physiological psychology. Then you have the social psychology. These are the major fractions. Then you have this educational psychology and all that stuff. The techniques of pedagogy and all that. So the teaching methodologies and all that. So when you come to the abnormal psychology, so abnormal is what is away from normal. We have a person is defined for normal behaviors. When it gets distorted, then behavioral disorder comes into play. So that's basically divided into two categories. So you have this neurosis, like neurotic diseases and psychotic diseases. Neurotic diseases, most of it can be recorrected. Psychotic diseases cannot be recorrected. That's a major division of these two.
So which are the, for our viewers to understand better, which are the diseases that would fall into the neurotic and psychotic?
Yeah. Neurotic diseases are hysteria. You must have heard hysteria. Phobias, all kinds of phobias. Obsessive compulsive state. What is obsessive compulsive state is, that's something to do with the memory. You have locked your wardrobe and it is not registered in you. Again you go and check. Again you go and check. You keep doing it 4-5 times. That's obsessive compulsive state. Or when you give instruction to a person, you keep on repeating it. You keep on telling the same thing again and again and again. Because once you have told, you are not aware that you have told him, please bring in my car key. Again you turn around, please bring in my car key. You keep telling something like that. You keep doing something again and again and again. That's called obsessive compulsive state. Then you have this endogenic depression and manic manifestations, which is a chemical disorder. So, like this, all kinds of small things, which can be recorrected.
They can be recorrected.
Yeah.
Through medication or?
Little bit of medication is there. A lot of clinical psychology evaluation is there. There's a basic difference between clinical psychology and psychiatry.
Right, yeah.
A psychiatry is a psychiatric doctor. Those who study MBBS, in a specialization, they go for psychiatry. Psychiatrist or the person who is authorized to prescribe psychiatric medicines, not the clinical psychologist. Clinical psychologists support the psychiatrist. If a patient, I'm a psychiatrist coming to me, I evaluate whatever little by conversing with the person or the people around him, and then I will transfer the patient to a clinical. You are a clinical psychologist, I will send the patient to you. Then you have lot of, in practical psychology practicals, you have lot of formats, question and answer, like lot of things are there, test methodologies, in which you analyze this patient, and after conducting all the tests on him, these are not blood tests or anything. These are something like, there are a lot of psychology. Yeah. And then you say, okay, this person having a phobia of so and so, whatever. Your diagnosis in clinical psychology, you diagnose a patient, what is his problem, and then that recommendation will come to me as a psychiatrist. My report, my test reports, and my evaluation. Like our radiologist take an X-ray, and then he'll say on the lumbar region there is a 2 mm crack. The radiologist will write a report by analyzing the X-ray. Like that, this is also. Then the psychiatrist will confirm it once again and prescribe whatever medicines are available. Like this it is. These are neurotic diseases. When it comes to the question of psychotic diseases, you must have heard about schizophrenia.
Right, yeah.
Delirium, delusion, and you have these high manic states, all those kind of things, So, those are vulnerable diseases where the entire hematology, biochemistry changes. If you take a very high schizophrenic patient, his copper content in the blood has become very high. They don't know why. They have no reason. For most of the psychotic diseases, we have no medicines. We have no medicines means we have no cure.
We have no cure. I think the only solution today is to suppress them.
Yeah, they sedate him. Sedate him. They are, modern science is trying to study the brain-related chemicals. There are a lot of chemicals produced in the brain. We have studied only to a small extent now. Maybe in my estimation, in the next 100, 150 years or 200 years max, the biochemistry will be in a better position to go closer to these chemical changes in the brain, where the chemicals which are responsible for distortion, behavioral distortion, they call it a psychological distortion. The coherent behavior will not be there. Suddenly they may scream or, all kinds of things. So maybe in 150, 200 years, they should be able to come closer to find out why exactly all these things are happening.
So coming back in both the cases of neurotic and psychotic, is it to begin with a chemical change, or is it a social or personal trigger that actually induces these? Because a lot of times in terms of depression, or maybe not maniac anger, etc., but depression, we assume that it's the social conditioning of the person, or maybe whatever they're going through, that actually sparks this kind of behavior. So is it really a chemical brain related issue for both, or is it to do with the condition?
Yeah, basically, if you see the family surroundings, especially the parental conditions. So, the psychologists have very clearly analyzed, and even the modern scientists have analyzed that 0 to 6 years of childhood is the basic time period to which molds an individual, his basic personality characteristic traits. That is the one which decides this person when he grows up. So in that period, how best that you handle a child and make him, mold him, or try to teach him all those kind of things. If suppose, for example, right from the time the child is born, if there's a lot of misunderstanding between the father and mother, and they keep on fighting, quarreling, or sometimes the child is exposed to the husband abusing the wife, the child is seeing the mother is getting abused, or physical torture by the husband to the wife, or wife to the husband. It happens in both ways. All those kind of things create a lot of impact in the child's brain, which leads to high emotional imbalance as the child grows up. And the sexual discipline of the father and mother is the case history of most of the abnormal patients. If the child has to see mother having another partner, or if father having many sexual partners, if the child is exposed to that, those creates a lot of impact in a human brain. If you go through case studies, if you go to a mental hospital, all these psychotic, the clinical psychologists and the social workers, they make the case study of the whole, why this person, what was his childhood, what has impacted him, from which age he has turned with his behavioral disorder, why he had come so worst. Parents neglecting a child. For example, if a person is married and he lost his wife and he's got a kid and he gets married to another woman, and that woman ignores this child, then what happens to this child? He'll have a terrific impact. Or a lady who's married, got a child, lost her husband, then she gets married to another man, and that man tortures this child because that child doesn't belong to his gene. He doesn't like him, like that child. So he starts hating, torturing, whatever. Like this, there are many number of reasons are there for a person to go wild in his behavioral distortion. So it runs, there are many reasons for all these things. That's how it goes. When you go through the case history of these people, there'll be a file. You can read all these things.
Thank you very much for spending your quality time. Thank you very much for your attention. I wish you enjoyed this session. See you later.